Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 88. Immune tolerance and MS, how the RED4MS study could change MS treatment with Dr. Andreas Lutterotti. Hello, Andreas. It's such a pleasure to have you on the show and to talk today about the new study, RED4MS. Hi.
Hi. Thanks for inviting me. It's great to be here.
And before we actually start with the interview, it would be lovely if you could introduce yourself to the audience so they know who is with me on the podcast today.
Yes, of course. Yeah. So my name is Andreas Lutterotti. Maybe you hear from the accent also in English. I'm originally from Austria. I'm a neurologist by training, was working in several different universities. I'm married. I have 3 kids, although 2 of them are not really kids anymore. But yeah, I like to travel and going by bike. This is what we do also together in the family.
Great. And of course, living in Switzerland, there are a lot of options to do so.
Yes.
What was your motivation to go into neurology and to end up as a chief medical officer at Celeris AG?
Oh, well, this was not an original motivation. But yeah, no, motivation to go into neurology is because, of course, the brain and neuronal system, I think, is quite fascinating. I think it's a very important part of us and was always puzzled and yeah, very much interested in going into this and to understand and treat neurological diseases. And originally, of course, I did not have the motivation to at one time work in a company and develop a treatment. But very early when I started to work on MS, I must say this was the time when we did not have so many treatments as we have now, and where it was also sometimes frustrating with the options that we had as physicians. And therefore, at that time, we already was interested in going into developing the research of developing new therapies. And then it came as it came, yeah.
Okay. And what is the main goal of the RED4MS study, and how could the new medication potentially benefit patients with relapsing remitting MS?
Yeah, so the RED4MS is a very early stage clinical trial, one must say, so phase 1 and phase 2. And the goal that we have is that we want to approach treatment of an MS differently to what we have at the moment on the market. So our current treatments are based on suppressing more or less the whole immune system by different aspects and different depths of depression. But the way that we want to treat is that we induce what we call immunological tolerance, so that we treat only those parts of the immune system where we think that this provokes this autoimmunity in the brain and the inflammation in the brain. And since RED4MS at the moment is at a very early stage, the main goal would be to assess whether this is safe to do so in our patients. And then in the second step, we would also like to understand already now whether there is some signal for efficacy introducing disease activity.
Yes, thank you. And I think not all listeners know that there are phase 1, 2, and 3 clinical trials with humans. And before that, of course, a lot of other research is happening.
Yes. Mm-hmm.
So how does this therapy aim to retrain the immune system to stop attacking the brain and spinal cord in MS patients while preserving the normal immune function?
Yeah, so the main principles of we call these therapies antigen-specific therapies. And this means that we think that the immune system in MS patient is directed against specific structures that we now call peptides. Yeah, and we have identified some of these structures that are important as the target of the immune response in MS patients. And what we do now is that we take these peptides, these structures, and we put them on own red blood cells. And then these red blood cells are infused again into the patient. And what happens then in the body is that the immune system is retrained because it now sees these structures on an own cell. And then it is retrained that these structures are self and therefore should not be attacked by the immune system. And this is the retraining that we hope to achieve.
Okay, so it's actually like I would go with a stranger to some other friends and they know the stranger is a nice one as well because I'm coming with that guy, lady to the party and
yes.
I'm not coming with somebody who is mean and bad. And
yes, actually, this is a very, very, very good way of showing this. Yeah. Mm-hmm.
Okay. So who is eligible to participate in the RED4MS study and what criteria must MS patients need to be considered?
Yeah, so these are patients that have a diagnosis of a relapsing remitting MS course of the disease, and the duration should not be more than 10 years, so should be rather in the early stage of the disease. And they are not allowed to have an immune therapy while they are in the trial, because otherwise we would not be able to assess the safety and also whether the efficacy is due to the new treatment or the old one.
Okay, so they are not allowed to have ever had a therapy, or?
No, they are allowed if they had a therapy, and then we have certain periods of time which differ between the different therapies, but that one could then look at and discuss with the investigator, where one should have been off the therapy. So it could be from 4 weeks to several months, depending on the treatment.
Yes, of course, because they last normally a bit longer for depending.
Yes. Mm-hmm. Mm-hmm.
Okay, great. What can patients expect during the trial, such as the number of visits, the type of assessments, and the general commitment involved?
Yeah, so as I said before, so the main goal is to assess the safety. And this is what is very, very important for us. And this is also the reason why we will have several visits, up to 11 visits in 24 weeks, for example. And then there will be also additional phone visits where we call the patient, for example, directly after giving the treatment. We will call the next day and see whether everything was well tolerated and the safety is maintained. So there are several visits during the trial where we assess safety, but we also ask whether they take any other medication, where we do neurological assessments. And in some of the visits, we will also do, for example, an magnetic resonance imaging of these patients.
Okay, great. Yeah. That gives an idea of how much effort is involved in that. What improvements in the daily lives of MS patients are expected if the therapy is successful?
Well, this is a difficult question because I must say today we don't even know whether the treatment is effective. Yeah, so as long as we don't know, we cannot say whether we will improve anything in the life of a MS patient, which of course we hope to. We can only speculate on this. But if it would be effective at the end of the day, I think the advantage would be that we hope that it is a treatment that is very safe, and does not have the side effects of the other immune therapies that we have, of the immunosuppressive type of immune therapies that we currently have. Therefore, there might be less need to do like blood testing for safety reasons. There might be less risk for infections during the year, problems with vaccinations if this should be needed, for example, or the impact of treatments on, for example, family planning. That is a theme in many patients.
Sounds good, yes. And actually, the listeners can't see it, but yeah, my daughter is here with me, so family planning is important. And and of course, I think one important thing, just for the listeners to recognize, serious people always mention, like Andreas just did, what can be expected and what can't be known as of now. So please always be very
critical, maybe.
Critical, thank you. Be critical when somebody says, yes, I can heal MS and I can help you, and you just have to take this pill, which costs 500 euros whatsoever. Yeah, thank you for helping out. What potential side effects should patients be aware of, and how will their safety be monitored during the trial?
Yeah. So from the side effects, at least from the experience that we have with prior trials using a similar approach, we do not have clear side effects that we expect in these patients. But what is a potential risk that, of course, we take very seriously is that at the end of the day, maybe we induce the opposite, so that we do not tolerize but activate the immune system against these structures that we put on the cell. We haven't seen any indication that this could happen, from prior research, but also from prior clinical trials. But of course, it is something that we take very serious, and is also one of the reasons why we do the safety follow-up on a very stringent way, why we do the MRI assessment to being able to identify if this would occur. But I think it's important to know for patients that this is a potential risk.
Yeah. Absolutely. What steps are in place if a patient experiences side effects, and how will the trial ensure that the treatment remains safe?
Yeah, so of course we will take care that we will do the follow-up. We ask patients whether there are any changes in their life that they experience. And then, of course, patients might not know whether it's a side effect of the treatment. So we would just have to follow up and assess everything that happens in their life that is not expected or is something that they would not consider normal. And then we will, of course, document this. And if things, for example, would happen in many patients, then, of course, it's even more possible that this is related to the treatment. So we will do a thorough follow-up of patients, document everything. And if it's needed to do any intervention, of course, then the investigator, the treating physician, is allowed to do any intervention that is needed for the patients to be done.
Great. How are doses administered, and why are there different dosing groups in the study?
Yeah, so the treatment is given as an infusion, meaning that there's a bag that is given over the vein in patients, and they will have, we call it 2 treatment cycles in the trial, and then they will get different bags, and the bags can then either contain the treatment, so the peptide-coupled red blood cells, or the own cells, but that do not have the peptide on the surface. And this is just to maintain, let's say, a blinding for the dose, so that we do not bias patients or also the investigators on the dose that was given. But in the trial, every patient will receive at some dose of the treatment. So there will be no, what we sometimes call placebo arm, that there will be patients that do not receive any treatment at all. This on purpose is not done in the trial. Everyone will receive a dose, but there are different doses. And the reason for this is that we don't know which one is the best dose. This could be the lowest dose, but this could be the highest dose or the mid dose. This is just to try to identify which is the dose that is not only best tolerated, but also has the best efficacy.
Yes. And I think, yes, it's a great thing that nowadays there is no trials which are compared to placebo, because
Yes. Mm-hmm.
it's a serious disease. So it is important that you get the chance of treatment. And from our multiple sclerosis management studies, I remember that sometimes, yes, as you just explained, a lower dose was as efficient as a higher dose, but sometimes with less side effects. So it is important to always check on these.
Yes. Mm-hmm. Mm-hmm.
So how does the dose escalation in Part A help determine the dosing strategy for Part B of the study?
Yes. So as you said, so we have for Part A, a first part, and then a second part. In the first part, we are even more focused on the safety of the treatment. In the second part, we will also try to assess whether this is efficacious. So the first part is really only meant to really assess the safety. So if all 3 doses are safe, then all 3 doses will be used also in the clinic in the Part B of the trial. So from Part A, we will not know whether one dose is better than the other with regard to efficacy. So we will not do a change in dosing, or we will not exclude some doses because of efficacy. But we will continue with all 3 doses in Part B if all of them are safe.
Okay, thank you. What are the key markers of success that the study will use to measure how well the treatment works in reducing MS symptoms or slowing disease progression?
Yes. So the key markers, and these are also the most sensitive that we have at the moment, are lesion activity on MRI. So we will do follow-up on MRI, and we will see if more lesions appear or not. And this is the marker that we can use to test whether the treatment is efficacious or not. But in addition, we will also put a lot of effort in trying to understand at the immune system level whether we really achieve this retraining of the immune system. This is why also we asked them, the patients, to donate blood for this. And then in the lab, in our company, then we will analyze this blood and see whether the reactivity from the immune cells changes over time. And this is important for safety, but also for efficacy.
Yes, absolutely. How could the data from this study impact future MS treatment options? I mean, it's very elegant to make the immune system aware of that the structure is not bad.
Yeah. So if it is successful, then I think it would be so if it's not only successful, but also safe, then of course it would be an elegant way to treat in the future, that we retrain the immune system and hopefully can then stop a new inflammation from appearing without suppressing the immune system.
Yes. And if it is successful, what are the next steps to make this treatment available to more MS patients?
Yeah, of course, then even if it's successful in our RED4MS trial, this would then mean that we can continue with the next step in clinical trials. So what we expected, usually you would need another so-called phase 2 clinical trial and then another phase 3 clinical trial. So I guess, and this is important also to make sure that the efficacy is not working. It's not only for a very small group, but that if you use it on a broader range and treat many, many more patients, that you really still maintain the efficacy, and only then it will be allowed to go on the market. So it will be a few years still.
Yeah, of course. But that's the case. And I think it's important to be aware of the fact that it always takes a while, but it's also more or less very safe when medications get on the market because they have been through many, many tests and studies.
Yes.
Could the therapy lead to long-term immune tolerance, reducing the need for ongoing treatments in the future? I mean, I know it's a very theoretical question.
Yes. Mm-hmm.
In theory.
Yes. Yeah. I mean, that would be, of course, a very, very good situation if that would come, that we do not need any more treatments. Yeah. I don't know, of course, whether we can achieve this. Yeah. If there is research data that shows that this effect is really long lasting, but this is in disease models. We don't know whether this is true in humans. So it could be that also with this therapy, we might in the future need to do the retraining from time to time. So giving again new doses after 1 year, 2 years or so. This I don't know at the moment, and this we will try to find out, of course, in the clinical development.
Thank you. Very, very interesting. So we are coming actually to the quickfire Q&A session. Luckily, because my daughter doesn't want to do the interview any longer. Complete the sentence. For me, multiple sclerosis is?
Well, it's a terrible disease that we need to defeat once and for all. Yeah. And I think we are on a good way to be there.
Yes. What development would you like to see in the field of multiple sclerosis in the next 5 years?
I think we are very good now in immune therapies. What, of course, is missing and where we could improve is therapeutic strategies for more efficient neuroprotection of patients, but also to treat important symptoms like fatigue, for example. I think these are very important aspects that are relevant for the quality of life of our patients. Yeah.
Absolutely, yes. And I think there's also lots of things happening. Finally, what message of hope or encouragement would you like to share with the individuals living with MS?
Yeah, well, I think that we have been very successful in recent years. Or as I remember when I started, I told you that I was very often very frustrated about the therapeutic options that we have. I think this has really changed a lot. So we are very effective now, and this is a very good development. And if we compare this development, which is only 15 years or so, to newer other developments, for example, in neuroprotective, maybe even neuroregenerative therapies and improvement of symptoms, then I think we can really be at a much better place in the next couple of years.
Yes, absolutely. So people from which countries can take part in the clinical trial?
So for the RED4MS trial at the moment, we have sites opened in Germany, in Czech Republic, in Switzerland, and in Italy.
Okay. And how and where can interested people follow your research activities and maybe get in contact if they are interested in maybe being part in that trial?
So you can always go on our homepage, so the www.celeris.com as one option, and then you can also look on the official databases. For example, there's a database that is called clinicaltrials.gov, where you can look for clinical trials and also see which sites are involved in this clinical trial. So whether there's a site nearby you in where you live. And this you can find there. So www.clinicaltrials.gov.
Fantastic. Andreas, thank you very much. And of course, I will put these links into the show notes and into the blog article. Good luck with the trial. I hope it is as successful as the preclinical trials look like, and of course safe. And yeah, I'm will be looking for the results. Of course, it will take a while, but maybe we can talk about it whenever it's done.
Yes, sure. Yeah, thanks for the invitation. It was nice talking to you. Yeah.
Thanks. Bye-bye.
Bye-bye.
I hope you enjoyed the episode and learned something new about the RED4MS study. And I think in the future, I will try to bring up interesting clinical trials here on the podcast, so you know where you might be interested in and might take part in. By the way, next time there will be another ACTRIMS special, and this time I will summarize what was presented about sexual dysfunction, and I think this will be interesting again. And remember, if you know somebody who might be interested in the podcast, please let that person know. If you want to become a guest and talk about your story, please contact me at ms-perspektive.com. And as always, stay as positive and healthy as possible. And see you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.